Today, we're going to dig into a really critical question in medicine. When a patient is facing severe alcoholic liver disease, how do doctors use evidence, cold hard data, to make a life or death call? Let's get into it.
You know, this gets to the very core of what modern medicine is all about. When someone is that sick, a doctor's gut feeling just isn't enough. They need solid evidence, a clear roadmap. So let's follow that path and see exactly how they find it.
Okay, so before we can understand the big decisions, we've got to understand the disease itself. And it's not just one single thing. It's actually a spectrum, a progression of damage that happens over time. Basically, alcoholic liver disease is a big umbrella term. It covers this whole range of liver damage that's caused by alcohol, and it can be anything from a relatively mild problem to an absolute life-threatening crisis.
See, the disease usually moves through stages. It might start with something called fatty liver, then progress to alcoholic hepatitis, which is serious inflammation and can end in cirrhosis, where the liver is permanently scarred. Knowing which stage a patient is in is absolutely crucial for doctors.
So, how do doctors figure out what's actually happening inside a person's body? Well, the investigation starts with the blood. They're basically searching for hidden clues, kind of like a detective working a case.
One of the very first signals they look for is an enzyme called gamma-GT. When the liver's getting stressed out from alcohol, the gamma-GT levels in the blood tend to just shoot up. It's a classic red flag that something's wrong with the liver.
But here's where it gets even more specific. Doctors compare two other liver enzymes, AST and ALT. Now, in most other liver diseases, it's the ALT that goes up more. But with alcohol damage, the AST often rises way higher. So if the AST level is more than double the ALT, that is a powerful clue pointing directly at alcohol as the cause. And then, if that ratio climbs even higher, to more than 3 times the ALT level, well, we're not talking about just a clue anymore. That is a major alarm bell. It strongly suggests the patient is having a sudden, really severe attack.
And this is where our focus really narrows. We're shifting from the long-term spectrum of the disease to a single critical event, an acute attack.
This isn't just the condition getting a little worse. This is a full-blown medical emergency. Acute alcoholic hepatitis means the liver is so inflamed that it's starting to fail, and without immediate, effective treatment, the risk of death is incredibly high.
So to get a handle on just how severe the attack is, doctors use a special tool called Maddrey's discriminant function, or DF for short. It's basically a scoring system that tells them how bad the situation is and helps them decide if the patient needs aggressive treatment right now to survive.
Now, this score isn't a guess. It's calculated using cold, hard numbers from the lab, specifically how fast the blood is clotting and the level of a substance called bilirubin. Both of these are direct measures of how well the liver is or isn't doing its job. It's a purely data-driven decision.
All right, so once that DF score comes back high and confirms it's a severe case, the doctor is facing a massive choice. What is the best way to step in and save this person's life? This brings us to the central dilemma.
For a long time, there were 2 main drugs in the running. On one hand, you have prednisolone. It's a powerful steroid designed to just crush the dangerous inflammation that's destroying the liver. The other option was a drug called pentoxifylline, which some doctors believe might also help.
And this was the million-dollar question for doctors in emergency rooms everywhere. With a patient's life literally hanging in the balance, which one do you pick? Do either of them even work? They needed a real definitive answer.
And to get that answer, medicine turns to its most powerful tool, the clinical trial. In this case, the final verdict came from a landmark piece of research called the STOP-H study.
The whole point of the STOPA study was to cut right through all that uncertainty. Researchers directly compared prednisolone and pentoxifylline in patients with this exact condition to see what really made a difference. All right, this is the moment of truth. This is where years of medical debate and best guesses finally meet hard data. So what did the evidence actually show?
The results were stunningly clear. The study tracked whether patients survived for 28 days. For the patients who got prednisolone, survival rates went up. But for those who got pentoxifylline, there was no improvement whatsoever. It had 0 effect on the outcome.
So the takeaway here is massive. The debate was settled. The evidence proved that the steroid, prednisone, could actually save lives in the short term, while the other drug just didn't work for this at all.
And that brings us right back to our original question. How do doctors make the right call? They do it with evidence just like this. The STOP-Age study gave them a clear, unambiguous answer that has literally changed how this is treated, and it gives doctors the confidence to choose the one treatment that offers their patients the best shot at survival.
This whole journey really shows you the power of evidence-based medicine. The study settled the urgent question of short-term survival, but that just leads to the next big question. After a patient makes it through that crisis, what's the single most important factor that determines if they'll ever truly recover for the long haul?